Now this is actually a great framework to think about. Actually, I never thought about the Canadian Health Act as it's almost like like you suggested, it's a contract between the feds and the provinces. Like, not that you have to do this, but if you don't do these things, then you don't get this extra money, right? Like, yeah, here's the carrot, and the stick is we take the money, take the
Exactly.
money away, right? Now, thinking about potential solutions, you talked about two possible. Well, I guess there's many possibilities, but the two kind of extremes. One would be private, and one would be everything public, right? Like, I'm sure there's intermediates in between that as well. Like, how would the Canada Health Act need to evolve in order to allow for, let's say, both the public and the private solution to, let's say, from a public would be, let's say, nurse practitioners being more prevalent, right? Like, for as example, could you lay out how the Canada Health Act would need to change, and actually how would you even change it?
Yeah, but you can change the Canada Health Act, but there's a lot of other things. There's a lot of other possibilities that we could do. I think that our evaluation of our own healthcare system is pretty distorted by our proximity to the US, which really is a poor system on so many counts. I mean, we tend to think of healthcare as a binary choice. Either we protect what we've got, or we just end up with American healthcare, right? And again, American healthcare, it's a bad system. All sorts of things wrong with it, including gross inequity and inefficiency. But because of this, Canadians tend to want to protect the status quo here in Canada because they don't they don't want to have to deal with American style healthcare. Um, but again, this isn't simply a binary choice between two alternatives. Anybody, for example, if any of your listeners have lived in a Western European state, they know that some of them actually have reasonably good healthcare systems. And the biggest, I mean, so going back to the Canada Health Act, the Canada Health Act could say, and what it's trying to do is to say, okay, basically, provinces, you have to expand the kinds of services so that all the services provided by all these other non-physician healthcare providers have to be covered. And the provinces are going, okay, right. Who exactly is going to pay for this? So the feds are upping the ante in terms of costs, and that's really where the rubber hits the road. Is it's fine to say, oh, you should do this, you should do that, but if the provinces say, well, if you're not going to help us pay for it, then forget that. And um, another important thing that Canadians should know is is to think about what's covered. So probably another structural issue, the biggest weakness of the Canadian system is that it's narrow and deep, right? Which means that we only insure two aspects of healthcare, right? We insure hospitals, hospital services, and we insure physician care. And people pretty much have to pony up for anything else. So, for example, if your doctor says, well, there's a drug that will cure you and you don't even have to go to the hospital, well, that's great news. But only if you have private insurance, because otherwise you're paying for your treatment out of pocket because it's not being provided by a GP. It's not being provided in a hospital, right? And increasingly, as we know, the kinds of treatments that people are using, things like pharmaceuticals or all the mental health care services, are usually not covered unless, again, they're provided in a hospital, or you have a particularly generous provincial healthcare system that says seniors can get insured for blah 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 or whatever. So while we think of our system here in Canada as highly equitable, in fact, it scores consistently quite low on international indicators of equity because, largely because so many people have to pay for their own care unless it's provided by physicians or hospitals, right? So there are huge inequities in the Canadian healthcare system that we don't like to think about. Um, so, we could, for example, contrast this with a system like France, which, rather than being narrow and deep, is broad and shallow. And this means that the French system covers a lot more things than the Canadian system, right? And not only drugs and counseling, but also things like dental and optics and physiotherapy. And in fact, France has, I think, one of the lowest rates of out-of-pocket payment in Europe, and much lower rate than Canada's. Um, but at the same time, France rarely pays the full cost of everything. So in generally social insurance, which essentially is public insurance, so essentially the public insurance pays 60 to 80% of costs, right? So um, if you're in a hospital, you pay the remainder. You might pay 30% of your care. You go to a GP, you pay 30% of your care. So almost all people in France have private insurance to cover the remaining, 20 or 40%. So the state will cover public insurance, social insurance. It'll cover 2/3, say. But the remaining 20 to 40%, people have to cover themselves. So people will take out private insurance. Now, you might well say, well, that's regressive, right? Because poor people have to spend a greater proportion of their income on private insurance. And you'd be absolutely right. So what France does is to ensure that the less well off not only have the public insurance that everybody has, right, but that their complementary private insurance, what's used to pay the remaining 20 to 40%, is also essentially paid for by the state. So there's like a parallel system to this private complementary health insurance that is actually state health insurance that mimics the private insurance, but it's for the less well off, right? And it's kind of neat that the French state funds this faux private insurance for poor people by taxing the private insurance companies, right? As well as through sin taxes like liquor and tobacco and whatnot. So it's got a lot of mechanisms to ensure that while there is a private presence, what you do is protect the less well off, right? And what else? The French state also ensures that the private insurance component isn't disadvantaged to poor and sicker people by ensuring a fairly strict regulatory framework on this kind of insurance. So, here in Canada, we think public, private, public good, private bad, public. But essentially, what most European states understand is that that's not the relevant um, way of thinking about healthcare, because you can have private healthcare that faces so many regulatory requirements that essentially operates the same as public healthcare. So it could be, again, for example, more progressive rather than regressive. And the principle behind the French system is that healthcare, should be available to people on the basis of need rather than the ability to pay. That's the principle for French health. Does it sound familiar, right? So it's very similar in that. So its objectives are very similar to Canadian healthcare. And while France does allow private players, they rigorously incent them to follow what France calls solidaristic principles, using tax and other incentives. So it's a completely different system than the one we're used to, but at the moment it's actually doing a better job than our system, notwithstanding its own issues and problems. Of course, it has them. It's very complex. It's pretty expensive, but you can't get everything, because if there were a magic bullet, we'd all be doing it. Um, and now of course, it's not to say that we should drop everything and emulate France immediately, but rather that, there's all sorts of ways of doing things differently that don't involve just becoming more like the US. So, we should be open to at least thinking about doing things differently, because simply doing things differently doesn't automatically give us American style healthcare. And in fact, doing nothing opens up all these gaps and loopholes, which does basic private healthcare. So there you go.